Cefaclor Er is a type of antibiotic that is used to treat many different bacterial infections, including skin and respiratory tract infections. It works by stopping the growth of bacteria. It is important to note that this antibiotic only treats bacterial infections and will not work for viral infections such as the common cold or flu. It's crucial to use this medication only as prescribed by your healthcare provider to ensure its effectiveness. The daily dosage and optimal timing for taking Cefaclor Er will depend on the severity of your infection and should be determined by your doctor. When taking Cefaclor Er, it's important to follow your doctor's instructions and take it with a meal every 12 hours. Swallow the tablet whole with a full glass of water. Remember not to crush or chew the tablets, as doing so can release all of the drug at once, increasing the risk of side effects. For the best effect, take this antibiotic at evenly spaced times. To help you remember, take this medication at the same times every day. Continue to take Cefaclor Er until the full prescribed amount is finished, even if symptoms disappear after a few days. Stopping the medication too early may result in a return of the infection. If you use antacids, take them at least 1 hour apart from this drug, as antacids may decrease the absorption of Cefaclor Er. It's important to communicate with your doctor if your condition lasts or gets worse. Some common side effects of Cefaclor Er may include stomach upset, headache, nausea, vomiting, or diarrhea. If any of these effects persist or worsen, it is important to inform your doctor or pharmacist. It is essential to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential risks of side effects. Many people using this medication do not experience serious side effects. However, it is important to notify your doctor immediately if you experience any serious side effects, such as persistent nausea or vomiting, stomach/abdominal pain, yellowing of the eyes or skin, dark urine, unusual joint pain, new signs of infection, easy bruising or bleeding, signs of kidney problems, or changes in mental/mood. In rare cases, this medication may cause a severe intestinal condition due to a bacteria called C. difficile. If you develop symptoms such as persistent diarrhea, abdominal or stomach pain/cramping, or blood/mucus in your stool, it is important to seek medical attention immediately and avoid using anti-diarrhea or opioid products, as they may exacerbate the symptoms. Prolonged or repeated use of this medication may lead to oral thrush or a new vaginal yeast infection. If you notice white patches in your mouth, changes in vaginal discharge, or any other new symptoms, it is recommended to contact your doctor. While a serious allergic reaction to this drug is rare, if you experience symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing, seek medical help immediately. This is not an exhaustive list of potential side effects, so if you notice any other effects not mentioned, it is important to consult your doctor or pharmacist. If you are in the U.S., you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you may report side effects to Health Canada at 1-866-234-2345. Before taking Cefaclor, make sure to inform your doctor or pharmacist if you have any allergies to penicillins, other cephalosporins, or any other substances. It's important to discuss any potential allergic reactions or other problems with your pharmacist before starting this medication. Before using Cefaclor, be sure to inform your doctor or pharmacist about your medical history, especially if you have kidney disease, or intestinal disease, colitis. Cefaclor may affect the effectiveness of live bacterial vaccines, such as the typhoid vaccine. Be sure to inform your healthcare professional that you are using Cefaclor before getting any immunizations or vaccinations. Before undergoing any surgery, it's important to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, this medication should only be used when clearly needed. Be sure to discuss the potential risks and benefits with your doctor. This medication passes into breast milk, so it's important to consult your doctor before breastfeeding while using Cefaclor. It's important to be aware of potential drug interactions and how they can affect the effectiveness of your medications or increase the risk of side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. It's also important to be cautious about certain lab tests, as this medication may interfere with them and cause false results. Make sure to inform the lab personnel and all your doctors that you are taking Cefaclor Er. If someone takes too much Cefaclor Er and experiences severe symptoms like passing out or difficulty breathing, it's important to call for emergency help right away. In the US, you can call your local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. Symptoms of overdose may include severe vomiting and seizures. Always seek medical attention if you suspect an overdose. It's important not to share this medication with others, as it has been prescribed specifically for your condition. You should only use it for the current infection and not save it for later use, unless your doctor advises you to do so. If you forget to take a dose of Cefaclor Er, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed dose and take your next dose at the usual time. Don't take a double dose to make up for the missed one. Make sure to store Cefaclor Er at room temperature, away from light and moisture. Avoid storing it in the bathroom and keep it out of reach of children and pets. Do not flush Cefaclor Er down the toilet or pour it into a drain unless specifically instructed to do so. When the medication is expired or no longer needed, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.